Hey everyone, Dr. Nuesse here again, and today we are doing another video, but this one's a little bit different as far as subject matter goes. Typically this channel is about permanent and natural weight loss. That's what I do professionally. If you want more information about that topic or about me or how I practice, please check out the link in the description box below. Today is specifically about hip pain and an exercise that I've recently discovered to help treat hip pain. Okay, so a little backstory about me. I actually suffer from hip impingement syndrome, sometimes called FAI, femoral acetabular impingement syndrome, and I've been dealing with an injury related to that for quite some time now. And I've been going through physical therapy, and my physical therapist actually showed me an exercise that really helped with my hip impingement syndrome and the amount of pain that I was in. So first things first, let me kind of get you through or take you through how the hip actually works, because it does play into what this exercise is trying to do. So typically a hip would be a ball and socket joint. So this would be your socket and this would be your ball. So your hip would fit in here and it kind of rotates back and forth as you walk. So it does two motions actually. It rolls around in the socket, but it also then slides a little bit back and forth in the socket. Not that much, but just to show you, just to illustrate. It slides and it rolls, and it slides and it rolls. And in people with hip impingement syndrome, that sliding sometimes doesn't happen correctly. So there is an exercise that actually helps develop that sliding process when your hip is rolling around in the joint. So this is a real simple exercise to actually perform. It's not a strenuous exercise. You're really letting the equipment do most of the work. So you do need a little bit of equipment. All you really need here is one of these rubber bands, these infinity looped bands. So you don't want one of those bands that you get from the physical therapist, just those long kind of stretchy bands that they'll give you to do exercise with. Those aren't going to be good enough. You're going to want a fully looped, a continuous looped band. And I got this really cheap off Amazon. It actually came in a set. Here is the name brand there. There's a bunch of different sizes which correlate with different strengths. You'll want to find the strength that's best for you. This one just seems to do the trick for me. So let me show you or demonstrate exactly what I do when I do this exercise. Okay, so the first thing that you're going to want to do is find some kind of solid pole. I'm using this squat rack here down in our gym. You don't need a squat rack, you just need something solid that you can loop this onto, and this is how you loop it on. So again, this is one continuous band. You're going to bring it around, bring one loop forward, and then just push the other loop through it so it kind of ties and locks on to the pole that you're tying it to. So from this point, what you're going to do is whatever leg is bothering you, whichever hip is bothering you, you're going to open up the loop and then stick one knee through and make sure the band is going all the way down in your hip crease, as far down into your hip crease as possible. Now, the other leg, the opposite leg, can be a little bit bent. You want to try to get it a little bit straighter so it's not straight up and down. So a little bit of a bend is okay. And then all you're going to do from here is scooch back so you start to get some tension on the band. And then you're going to take your hands and actually grab your knee, and you're going to slide your knee back up towards your chest. And you're going to hold it for a second, and you're going to slide it back down. So what's happening is you're causing, by pulling, that rolling of the hip inside the hip socket, and the band is causing that sliding motion. So you're using the band to help you increase that sliding motion and clear that impingement that might be going on with your hip. So you're just going to continue to bring it up, hold it for a second, and then back down. And then bring it back up, and then back down. And I do about 10, and it's real important to focus on really relaxing your hip, not tensing up with your hip, letting your arms do all of the work, bringing it up and trying to go a little farther each time, really getting that pull down. And again, I go through about 10, I take a break, and then I'll do 10 more. And this is about the pace you want to go as well. You want to really pull it up, hold it for a second, and then release, and then back up and let that tension kind of pull it down, and then back down, and then up again, and then back down. And that's basically it. That is not a complete hip rehab program or protocol, obviously, but that is a really good, that's the exercise that I feel has helped me most get more of that motion in my hip and feel a lot better when I'm doing different activities. All right, I hope that was helpful, everybody, and until next time, stay happy and stay healthy, and I'll catch everyone in the next video.